Aging is not something we plan for well in this country.
Right.
And so with that being stated, once the need occurs, it's a sticker shock in terms of, oh my gosh, I had no idea that this could cost anywhere, let's just say from $3,000 to $5,000 a month, and that's assisted living.
Well, hello and welcome back to another episode of the Thank Me Later podcast with me, your host, Jini, where we help you master your money and help you transform your life. I'm so excited for this new episode because we're going to talk about a topic that really has impacted my personal life. So what if I told you that you have a 55% chance that you will have to financially support one of your aging parents? You have a 55% chance. That's crazy, right? Like, more than likely that's going to happen for you. And the impact of that, particularly when it comes to helping your parent know where to live and be able to afford assisted living, nursing home, whatever all that is. So I'm super excited today that we have a guest who helped me probably with one of my most challenging times in my life. When I kind of think about some of the chapters of my life, Sharise Byrd, who I'm going to introduce you to, was really my guide to help my family when we moved my great aunt Anita from Los Angeles to Atlanta into an assisted living facility. And I had no idea what was going on. So Sharise Byrd, thank you for being here today.
Thank you, Jini.
Really appreciate you being here. So I want to let people know a little bit about you so they know how to engage with you. So you are the current program administrator for the Atlanta Regional Commission on Aging and Independent Services Department. Like, what does that mean? I'm like, I just said it. Like, what does that mean?
So the Atlanta Regional Commission is the regional planning agency for water, transportation, also aging for the 10-county metro area. So we are what you call the area agency on aging. So our goal is to promote home and community-based services, maintain quality of life, and especially for those seniors who may be needing more resources. So that's the kind of the focus of the area agency on aging.
And I know you because of your 10 years as executive director of assisted living communities for seniors. You were at Arbor Terrace. Mm-hmm. Shout out to Arbor Terrace here in Atlanta, where my aunt lived. Mm-hmm. So I want to just kind of set the stage today and kind of explain my family story and how you became an important part of that. So did you know Anita was not really my aunt?
I do.
Okay. So my play aunt, Anita, was really a tenant of my family for over 40 years. And she had taken care of 4 of my relatives and was married, but was an only child and never had any children. And she just was this angel in our family. And I just kept saying as she was maturing, oh, we'll take care of you. We'll help you. And then at 95, I had gone to Los Angeles for work. And I caught my husband when I got there and I was like, we're here. You know what I mean? Like, it's time. And I began the search for finding a place because I knew the way that our life was set up, she couldn't live with us. I knew she was going to need help. So I had visited several places. And honestly, Sharise, I had left a couple of places crying. I just could not believe that people live like this. And but the very first place that I visited was you at Arbor Terrace, which I loved. It was beautiful. I knew if my mother were alive, I would have put her there. But girl, I was in sticker price shock, mm-hmm. right? Because my aunt was a hairdresser.
Right.
Who had no retirement. All she had was Social Security at the time, which was like $1,500 a month. And I think at that time, Arbor Terrace was $5,000 a month probably. So there was a big gap that my family had to fill.
Yes.
And you were the one instrumental in, helping me get through the process, getting her set up, getting her straight. But it was difficult, particularly to make that financial commitment, not knowing how long we were making that financial commitment. And so I'm assuming that's probably our story has to be a common story for you, though.
Janai, first of all, let me just say this. I thought it was just a beautiful moment, a moment of integrity to your character and your husband in terms of taking care of Anita.
Right.
Because not everyone does that.
Right.
There are so many people who unfortunately get to a point of crisis because aging is not something we plan for well in this country.
Right.
And so with that being stated, once the need occurs, it's a sticker shock in terms of, oh my gosh, I had no idea that this could cost anywhere, let's just say from $3,000 to $5,000 a month. And that's assisted living. Memory care skilled nursing is much higher than that.
When you say much higher, what does much higher?
So memory care. So let me give a little background.
Okay.
So when you talk about senior living and the continuum of care, there's independent living, which essentially is a senior apartment. It is, I can pretty much function on my own. However, I want to be in the company for socialization purposes. And this is a social model with other older adults. However, when I need assistance with activities of daily living, toileting, grooming, dressing, medication management, meals, that's where assisted living comes in. You have staff available 24 hours, 7 days a week, and it's based on a care plan and an assessment in terms of, okay, what things can this resident do independently and what things does this resident need assistance with?
What are they going to need help with?
Absolutely. And then subsequently, if someone continues, let's just say they have a dementia diagnosis or Alzheimer's disease, let's just say that there are behaviors that start to occur and they start to elope or wander. Oftentimes, memory care is a better spot because it's a smaller environment. Now, it depends on whether that's all-inclusive or whether it's a base rate with level of care and medication management. So memory care could easily start at $5,000 upwards to over $10,000
a month.
Absolutely. Plus, if you have someone who, let's just say, I'm unable to balance myself or I can't stand without assistance, I have intravenous medication or I have a feeding tube that I can't care for independently, that's skilled nursing or nursing home, which means that in Georgia, a semi-private room is about $7,700
for a nursing home. Semi-private, so you can spend $7,000.
So there's like a college roommate on the side of you
for $7,000.
For $7,000. However, if you want a private room, that could be upwards to $9,000 a month.
So how do people pay for this? So when we talk about assisted living, that means that I need help getting dressed, possibly someone fixing my meals, maybe someone doing my laundry, those sort of things. Will my insurance pay for that?
It depends.
Okay.
So with that being stated, there are insurance policies, life insurance, that are what you call hybrids. That some have a long-term care insurance benefit, and then they also have a death benefit. So essentially, let's just say that policy is $200,000. $100,000 might be slated for the long-term care benefit. Essentially, that is a loan. So once the insured dies, that money then essentially has to be paid back on the policy. However, there's also long-term care insurance, which is specifically for aging. And with that being stated, the problem with that is oftentimes in life, we don't buy those.
And we're looking into it when we're too old.
Because
it costs too much.
If you're 55, if you want like $165,000 worth of coverage, it depends on what sex you are.
Right.
So your premium for a man could be something like $2,600 a year, and a woman might be close to $4,000. Really? Only for $165,000 worth of coverage.
Right. And so what I hear you saying, you have this loved one who needs assisted living. The only insurance that will pay for that is long-term care insurance. So what I hear you saying that Medicare does not, Medicaid does not. You do not get help?
You get help, but more at the skilled nursing
So we're talking about
home.
nursing home level, not
Correct.
at the assisted living
So
level.
the state of Georgia does not currently have Medicaid as a payer for assisted living. There is a study committee now with the Georgia Council on Aging that is advocating that the state of Georgia should allow Medicaid to pay for assisted living. However, that is not something Georgia has implemented. But if you're skilled nursing and your means tested, so essentially if you have, a certain income, there is a better possibility that Medicaid, public health insurance, and portions of Medicare, if you're coming out of a hospital like Part A for like 20 days,
right.
Your doctor refers you, and then, yes, he can write that order for skilled nursing.
Right. So when I hear you say this, although I've already been through this, I know how overwhelmed I feel right now.
Gotcha.
Because it's just like, wait a minute, wait. So my loved one has paid into insurance all this time.
Mm-hmm.
They're not going to get any help. Might vary from state to state, y'all.
Correct.
But more than likely, your Medicare or Medicaid is not going to pay for your assisted living.
That's very true.
So now if I need a nursing home,
Mm-hmm.
now my insurance may kick in at this point and help with that. My Medicaid, Medicare.
It's a possibility because if you have certain assets, let's just say 160 per se, 155. Well, the state of Georgia says essentially anything past it, you don't need assistance, that you can pay for.
You can pay the rest.
Mm-hmm.
Okay.
So with that being stated, it is, okay, do I have savings? Do I have, an IRA, a Roth, something?
Right.
What other assets do I have? What can family members do?
Right. And it's interesting, when my Aunt Anita was in Arbor Terrace, one thing that I began to learn very quickly with the other residents who were there, the majority of the people who lived there were educators.
They were.
And I'm like, okay, because they had a pension.
pension.
So now they can afford to be
Correct.
here. There was a couple physicians in there. And then my aunt, who was this hairdresser, this retired hairdresser. So, but Sharise, you and I both know, we can name on one hand the number of people who can afford to pay $7,000 a month.
Oh, absolutely.
So what in the heck do people do?
So in the interim, there's the home and community-based services. That's when you go through the area agency on aging. So that's my part of life where I work now. So you go through a process called the Aging, Disability, and Resource Connection. Essentially, they do an assessment, and then they determine what services you might be eligible for, where they can have someone come into your home. Now, with anything, this is government funding, so there are wait lists. There are, sometimes eligibility criteria that people don't meet.
Right.
And so with that being stated, that was the first step. If you don't get through that, then it is, okay, am I affiliated with someone in the local community church? Okay. Or am I affiliated with other community resources that can assist me? Because other than that, it really is a crisis.
And so I'm assuming, and I'm just going to speak from my experience at Arbor Terrace, I'm assuming there were a lot of people who came and visited, did the tour, loved the place, and couldn't afford to be there.
Oh, absolutely. And especially in the African American community.
Right. Because Arbor Terrace, in a predominantly Black neighborhood, which I hear is very unusual to have a facility that beautiful.
Yes.
Kind of a standout facility,
Yes.
I would say. And for it, all the residents, when my aunt was there, everybody was Black.
Oh, absolutely.
So I hear what you're saying, but I'm just, these numbers, what do we do? What do people do?
So you know what, Jini, one of the first things we have to do really is try to help get the word out so people start planning better. We don't think we need this until we know we need it.
Right. And we're late.
Oh my God, yes. And so even myself working in this industry, I have conversations with my mom about, okay, if such and such happens, here's what we're going to do.
Right.
Because many people cannot afford $3,000, $5,000, $7,000, $9,000 a month.
Absolutely.
Unless you might be a veteran. There's aid and attendant benefit. Again, there's income and eligibility criteria. you may be eligible for $2,300 as a single vet or $2,700, but you still may have a $2,000
gap.
Mm-hmm.
Right. So when we're talking about that generation of people who had a pension,
Sure.
or people who were veterans, there may be some additional benefits that they may be eligible for.
Correct.
Or two that other folks just aren't.
Correct.
Right.
Mm-hmm.
Wow, this is deep. One thing I was thinking about was I connected you to one of our coworkers, Ani, whose mom has early onset Alzheimer's. And I know when Ani first moved her mom someplace, I think it was almost $9,000 a month. Mm-hmm. And we were like, you have got to be kidding me. You have got to be kidding me. And like how people just say those numbers like, hey, that's normal. And I'm like, how can this be normal right now, today? Mm-hmm. And what is that going to look like 5 or 10 years from now? I don't even want to know what those numbers are.
Think about it, Jini, you got inflation.
Right.
And so let's just say on a 3%.
Right.
With senior living, you have annual increases. Okay. And so we understand that that's a business, but at the very same time, you understand that you're working with families.
With people, real people.
Absolutely. Who are sacrificing in many instances to have their loved ones here. So Rosalind Carter Caregiving Institute said it best. Basically, this is a public health crisis.
Right.
And more emphasis needs to be placed upon aging in this country. And again, you have the boomers coming through the system now.
Right.
Okay.
And there's a lot of them.
Absolutely. So with that being stated, I still think we will see many variations of what may to come. But unfortunately, I don't necessarily see prices regressing at all.
No. Because the demand is too high.
Absolutely.
Yeah. Definitely supply and demand. All right. I want to transition to our Thank Me Later hotline call. I know we had a question.
Hi, this is Ani from Atlanta. My question is, what strategies or tips can you share about dealing with or negotiating with assisted living facilities?
What strategies or tips when you're dealing with an assisted living?
And can you negotiate?
Yes. Mm-hmm. Number one, I would say always. You can always negotiate. And some of the things that you can negotiate are, okay, what's your admission fee or your entrance fee? Okay. Now, I will say this before I go on. Independent living, assisted living, memory care is probably more feasible or flexible than a life plan or continuing care retirement community or CCRC. I got you.
Okay. I was like, what does that mean?
So, life plan community means independent living through skilled nursing, encompassing rehab is all under one campus.
One campus.
And sometimes the buy-in can be $300,000, $500,000.
I've heard about those really in Florida. I hear that they're those type of communities. Mm-hmm. You come in your senior apartment, and as your needs change, you can age essentially in place, moving from the different level of care facilities that you'll need.
Yes.
But $300,000 buy-in.
Yes. The buy-in is substantial. So with that being stated, some of the things you just want to think about when you're moving in is, I would say one of the best things is your care. What does the care plan look like? Does that include medication management? What constitutes a level of care change? You want to look at your contract. Okay, what are my termination provisions? Do I have to give a 30-day? Do I have to give a 60-day? Again, you're subject to annual increases. What does that look like? Is it 3%? Is it 8%? Those are the type of things that you can negotiate. And anytime you go into a senior living community, one of the first things you want to look for is their last survey. In the state of Georgia, the Department of Community Health, Healthcare Facilities Regulatory Department does the surveys. And so it's just like if you go out to eat.
Right.
You want to understand the culture of this community, what things maybe have they been cited for, or do they have no deficiencies? Same thing, you want to look at their public health score. You want to look at customer satisfaction scores if they have them. You want to understand staffing ratios. You want to understand staff turnover. Do you have agency? Can I talk to your lead med techs? If socialization is important, Can I attend some activities? Come at different times of the day.
For sure.
Okay. What does the food taste like? Because again, it's very different experiences for different people. So anytime you're going to a community, these are just some of the things you want to keep in mind.
And so we should be empowered to say, hey, you all are offering me a rate of $7,000 a month. Hey, can we possibly look at $6,000 a month?
Absolutely.
And see, I think a lot of people don't even think that they're empowered to do that.
Absolutely. Because again, it depends on the community, but many times communities are willing to negotiate. And one of the things I would recommend, AARP has an assisted living checklist online.
Love that.
I would love for individuals, if you're not sure, go to AARP and do an assisted living checklist, and it'll give you different things to ask. You want to know if your loved one's impaired, if they can, what you call self-preservation, which means that the ability to evacuate that building.
Right, themselves. Right.
Absolutely. So you need to see, okay, who would help? How would they help? These type of things. So there are tools out there and resources.
And it's funny because that actually was my next question I was going to ask you about our resources. What can people do to educate themselves? Because like you said, you want to get in front of this as much as you can and be empowered and feel more confident when you're going to visit facilities or if you have a parent who's aging. So other than the AARP checklist, anything else that you can direct people to?
Sure. So there's the Georgia Senior Living Association website. That's an overview of all senior living, independent living, assisted living, and memory care. Go there. There's also the Georgia Healthcare Association, which is the same type of association. However, it's for skilled nursing. There's the Georgia Council on Aging. I would recommend individuals joining that. It helps you keep up with legislative priorities and changes that are occurring. And then also, again, your area agency on aging and or your county senior services, such that if there are opportunities where someone can help do outreach, educational type seminars, or help to also direct toward resources, typically this is where people start.
And for those of you who live in different states, please make sure that you're taking the same action, but for comparable organizations in your state.
Correct.
Because some of what you're saying, the majority of what you're saying is state-based and not federal-based. I think it's really important that people understand that.
That is correct. Okay. And every state has various area agencies on aging. They just have different names. There are 12 within Georgia itself. However, the Atlanta Regional Commission covers 10, which is Fulton, DeKalb, Gwinnett, Cobb, Cherokee.
The big counties.
The big ones, yeah.
Okay. David, I saw you grab the microphone. I thought we need to edit that part out. I thought you wanted to say something. You want me? I
got a question.
Okay. All right, hold on. Let me. All right, so now, you want me to throw it to you now?
That's cool.
Okay. All right, David, I know you had a question for Sharise.
And I'm not sure if you can answer this, but I've been told this. I've been told that at some point you need to almost make your parent look poor or whatever, kind of remove everything, put in different people's names or whatever so that they qualify for more. Is that good advice, or do you know anything about that?
So here's what I will say. There's a look back period with Medicaid. It's about 3 years. So if you see signs early that, I see changes in my loved ones, I think as a family, that's the time to start having family meetings. I would also say that's the time to consult also an elder law attorney and talk with them about what's the best way that we can utilize resources available to my loved one. But like I said, you just have to be mindful that there is a look back period. So.
David, while you still have the microphone, I just wanted to talk about the family impact. And, when we moved Anita from Los Angeles to Atlanta, I went out there in February. I think she was here maybe by August. So we were moving pretty quickly. But I don't think I really took into consideration the impact that it was going to have on my family. And I was fulfilling an obligation that I felt that I had for my family, which David did not know. He did not know all these other relatives that I had. And so, David, just I'd like for you to kind of, from your perspective, like we were thrown into it and that financial commitment. And it's not like college, like, oh, okay, in 4 years we're going to be done. How did you receive that and kind of manage that?
I was surprised at first, but it was extremely generous for Jini to make that suggestion because we'd been monitoring Anita out in California for a while, and we knew at some point we had to figure out what the next step was, and she couldn't afford it.
Sure.
And then as Jini went through the process of going and visiting different places and then coming back to me and telling me what the number was, I was like, especially when she got to Arbor Terrace. Yeah. I was like, wow. But Anita in California, because she was on her own, her diet wasn't right, she wasn't really getting any activity. Frail. She was kind of going downhill. And I don't want this to sound insensitive, but I didn't see this as long term.
And she was 95 back.
And she was 95.
Right.
She got here and got into Arbor Terrace and gained a few more years.
Let me say, bounce back. So, like Superwoman.
A couple more years into it, and I joke when I say this, but I was kind of, when she hit 100, I'm kind of looking like, all right.
Like, what we doing here? Right.
All right, we ain't going to keep this going much longer. Excuse me.
Right.
For saying it. But, after a while, that's a lot of money that we had not planned for that could affect our retirement or whatever, but we had made the commitment. So it was, and then it was even more than that. It was, and it wasn't bad, but, we had to go visit her and we had to go, it was just a lot more that we had not really accounted for, taken care of at that point.
David, becoming a caregiver changes your life.
Yeah.
First and foremost, your time.
Yes.
Okay, because you have to then spend time with this person. She lived for when Jani's coming. Oh, I knew. Right. David's coming. Yeah. So, that's the first thing. Then there's an impact on your family dynamic. Okay, there's a financial impact. There's an emotional and physical impact. So, the sandwich generation, you're taking care of an older person, but you still have young children that you're also taking care of. So the burden that comes with that, but understanding truthfully, it is a commitment. And especially, again, for someone who's really a friend of the family.
That was the other thing, because, I'm thinking, and I'm glad, because it really made me think, okay, my mother at some point has, God willing, will be here, So I'm like, man, what do we have to do to prepare for that cycle again? So it was, I'm glad it happened, and it was a beautiful thing. And
it was hard, though.
Yeah, but it was a little challenging.
It was hard.
Yeah.
And David, I'm glad you said what you said, because we moved Anita at 95. She was so frail, and I kept thinking, maybe she'll live 2 years. Sure. And then of course my family was like, "You're gonna kill her. Anytime you move anybody, you're gonna kill her." Honey, 97 came and went. She lived to 101. She lived to 101, but who knew that? Right. Good care.
Yeah.
She had gained more weight. She was heavier than she had ever been in her whole life.
She told me that.
Yeah, she had never gained that weight, but she had such good care. I just did not think that she could bounce back at 95. And so like David said, when we got to 98, 99, 100, and 101, we were like, what is happening? So I think, I don't know, maybe she was 99. I went to Arbor Terrace and I said, listen, this is not sustainable for us anymore. And we just never thought that she was going to live this long. And so I said, we're not going to be able to keep her here anymore. And I'm going to begin to look to move her. And you weren't there anymore. The director at the time said, let's talk about what else we could do.
Mm-hmm.
And I was like, I wish I would have known this was an option before, because I would have approached them earlier. Yeah. I did not think that was an option. Yeah. And so they were so flexible with me. We ended up moving her room. Okay. We were able to do some other things, which had significant impact on what the cost was. Right. And I was so grateful for that, because that move would have killed her. Yeah. And we were in such a routine. It was very close to where we lived. It was beautiful. So I was just like, no one ever told me that I could go and negotiate and pay less. One more thing, Sharise, that people don't tell you. You have to pay the facility fee, but that does not cover everything.
Oh, no. That's an entrance fee.
That's an entrance fee. So all of her, everything else, they were paying for, her care and all that
utilities,
stuff. Yeah,
essentially, but toiletries,
all her toiletries,
all your day-to-day items,
absolutely. Supply. I probably could have put 3 kids through college as much money as I have spent on Depends. Yeah, and you're not factoring all of those other things into your budget.
Correct.
So, those were things, and I could feel the tension at home, because our youngest son had just graduated from high school in 2012. We moved Anita in 2013. So I think we had a vision for our life and like what we were going to do with all this extra money now. And now we have this additional responsibility that we weren't prepared for. And Anita had been outlived her money. And I'm beginning to see that more and more and more of people who look like us, who are outliving their money and the responsibility that is putting on their families.
That's a hardship, Jini, because the problem with that is if there are not family members or friends who can help sustain you, if you can't downsize, that is option number 1, right? But if you've exhausted all other means, then what happens essentially is that's when you talk about Medicaid eligibility. There are pros and cons to that, but the reality is Medicaid-based care oftentimes comes with a lack of good customer service. Right. You don't always get the best care, in all honesty. And so with that, then you try to then become eligible at that point for it will probably be based on the level of care, skilled nursing.
Right. I remember when Anita fell one time, and of course, we fractured her hip, and she was in the hospital, and they were giving me the recommendations of the rehab facilities that she could go to, and they gave me the list, and I went to visit 2 places on the list, and I came back and I said, there is no way. She is not going to any of the places on this list. But I knew I had the power to do that, though. I knew that I had the power. And I think I called you and say, where would you send somebody that you care about? Absolutely. And that's when she ended up at Emory. Not convenient at all, but certainly was the best place for level of care. There's some places I walked in, I literally did not make it to the reception area. I turned around and walked right back out. I'm like, there is no way in the world. And I had a conversation with a social worker. You would not put anybody you care over there. Why would you send this to me? But I want people to know that they have the power, to have some pushback. Absolutely. When people are making medical recommendations on where folks
You can always say, you know what, I don't feel comfortable with my loved one being here. Right. And I would like to know what other alternatives are there for my loved one.
Couple more things I want to ask you. you already alluded to how to prepare for interviewing assisted living facilities. I'd like to kind of recap on that because that's really important. Can you just maybe like 5 to 7 key questions or things that you need to be looking for?
Again, I'll start with the first one, and that is, let me see your survey, because that lets them know that, they understand that there's a third-party agency coming in here to audit us, essentially, to make sure that we are adhering to regulations. Okay, that's the first thing I would say. Also, look at the health score. Okay, any entity, whether it's a restaurant, senior living, it shouldn't have anything less than a 90 if you're a head chef and the staff know what they're doing.
Okay.
From a care perspective, this is huge. You need to understand, how does your care plan work? And with that being stated, what's the frequency that we will sit down and discuss this? And if there's a fall or if my loved one gets sick, how does the notification piece of that work? Okay. And then how do medications work? Understanding, having done this now for years, I understand, you can give a medication an hour before and an hour after, but the average family member is not going to understand that when you walk in. So understanding, what is the schedule like for medications? What's the laundry schedule?
That was a huge issue.
It's a simple thing.
Oh my God.
Okay. Do you label everything coming into senior living? Why? Because things get lost, they get misplaced, including DME equipment, wheelchair pedals.
What does DME mean?
Durable medical equipment. Okay. So those are your walkers, your wheelchairs. Okay. Everything needs to be labeled. Coming
like you're sending a little kid to school.
Absolutely.
Right.
Everything needs to be labeled. You need to understand your contract. Again, you want to ask about increases for annuals. You want to ask about, is this all inclusive or is it a la carte? Do I have to pay extra for certain services? You just want to understand, who's the person I need to be able to contact? First of all, just to check in, but then also if there's something wrong. And I would always say you need a good relationship with your resident care director or director of nursing. However, also with the executive director. Because you need to feel like if I call this person, they're going to do something.
And they know who I am.
Mm-hmm. Oh, and this is just like a hospital. You have to advocate. So David talked about the time, but you do have to be present. So staff understand, they have loved ones who care about them and they come check on them.
Right.
And that is extremely important.
Yeah, I could tell the difference just being engaged, coming at different times.
Oh, absolutely.
I was intentional about knowing the staff by name. Mm-hmm. So that way I could build rapport.
Absolutely.
And I knew that they would look out for her a little differently.
Absolutely.
If I, had those additional eyes. Another question I wanted to ask you, you reference a lot of state government programs. Is there anything federal that people can do some research on, or is it really everything administered really at the state kind of county level?
So at this point, the federal dollars are more attached to Medicare and Medicaid.
Understood. Okay.
So Medicare, again, if you're coming like from a hospital for Part A, and for Part B, if you are skilled nursing. So, but other than that, there's not a lot from a federal perspective.
Nothing. Okay. And then for families, and this is in context of finances, what do you see families do wrong when they're coming to facilities? How do you see folks dropping the ball?
I think it's just lack of knowledge, really. It's ignorance. We don't know any better. And so we come in, and with that being stated, there is a complete different expectation than what reality is. And so, again, we have no knowledge of senior living and the inner workings of it. And so with that being stated, I think the best thing families can do not to drop the ball, they also need to get on one accord. A lot of time you see a lot of family dynamics.
So y'all seen all the drama.
A lot of dissension.
Yeah.
I want mama here. I don't want daddy here. Those type of things. So ultimately it's also oftentimes another thing I just thought about, Jini, sometimes family members are in denial.
of where their relative is. Yeah.
Understanding, okay, here's where mom or dad or loved one is. That helps substantially, because a lot of times, I think that's the other thing. We would sometimes have residents, and then we start seeing behaviors. We're like, oh,
Where'd this come from?
nobody told us.
He was going to be trying to escape.
Absolutely. So I think being as forthright as you can. I understand we want to negotiate,
Right.
but make sure they can take great care of your loved one. So especially if there's a mental health diagnosis, and people don't talk about that enough either. Because if you have a mental health diagnosis and you add dementia with that, that compounds being able to really care for that person. So just making sure that, your clinical team is as knowledgeable as possible. And then again, just trying to be on one accord about what's best for that loved one.
Okay. Well, I really appreciate you being here, Sharise. And again, thank you for helping our family navigate a very interesting chapter. But Anita loved Arbor Terrace.
Well,
she had a good experience there, but you set the tone with me right away, and I'm forever grateful for that.
You know what? I have genuine love and affection for you. And with that being stated, I just remember how Anita would light up anytime, Jini is on the way.
Right.
And with that being said, she found a sense of purpose.
She did.
She found other residents she felt like she could take care of, and they took care of her. And I think that's part of what helped her to live past 100. She found literally a sense of community within a community.
Right.
And so with that, I just believe that gave her purpose. Yeah. And I think anytime you're looking for a community, you have to believe that the person who's providing oversight of that community ultimately has the same type of mantra of, what would I want for my family?
For my family.
Absolutely.
So I want to focus on action steps. So for those of you who are watching, you have some to-dos, a little homework that you need to do. Number one, it's really important to look into long-term care insurance, whether it's for yourself or for your loved one. But you want to know what's offered to you, how much it costs, what are the benefits, because if you're young enough, you certainly want to put that in place. Sounds like you may need to have a family meeting right now. If you have an aging relative, there's no need in being in denial. It's time for you and your family to get on one accord and begin having kind of the talk. This is also a good time, too, to assess the assets. What does your loved one own? And also what reoccurring income that they have coming in. A pension, Social Security, and all that can be a game changer. But you want to know about that well in advance. And then the last thing that I'm going to recommend is when you start your search process, please look at multiple places, even if they're way above or even below what your standard would be, because I learned a lot from every interview that I did, and that way I could kind of compare and contrast facilities as well. So anything else? Any other action items you think people?
By you doing that recap, we need to think about living wills. We don't plan well enough about what end of life type of care that we do and we don't want.
Absolutely. So. And you definitely have family fighting about that too.
My gosh, yes.
Please make your own decisions now.
Yes.
So that way people know who's in charge.
Right. If you have an advance directive.
Yes. You're making your final decisions on how you want things to happen and who you want to make sure that those get carried out, so families not fighting about that as well.
Sometimes it's the same person for medical and financial. Sometimes it's different people.
Absolutely. But that definitely takes a lot of stress off of people. Thank you for saying that. So again, Sharise, thank you so much for coming. So if our community wants to engage with you, where can they find you?
You can find me on LinkedIn, and I am Sharise Thurman Byrd, and that's BYRD.
Thank you, Sharise, for sharing your information. Thank you for being an amazing guest. And thank you, all of you, for watching and checking in with us today. But listen, this information, very difficult to come by. Now you have to do your part. You got to take action, but guess what else you have to do? You need to be sharing this podcast and what you learned today with your family and friends, because that's how you are going to be able to master your money and transform your life. And we are here to guide you through that. And listen, like the podcast says, if you listen to us, I promise you will thank us later. You can engage with me on social media at TML Money and also personally at Jini Thornton. That's JINITHORNTON. And we'll see you next episode.